The candidate orgasm, right? So orgasm is a complex process where dopamine is released in the brain, right? And so we usually look at medicines that are inhibiting that, like antidepressants, SSRIs, sertraline, paroxetine, duloxetine, right? These are classic medicines I use for premature ejaculation, premature orgasm, right? But for delayed ejaculation, right? These are drugs that we want to stop and get you off. Wellbutrin is one that doesn't cause, the delayed orgasm, but still helps antidepressant. If it's not right for you, then it's not right, right? And talk to your physician before you're coming off those drugs. I've seen anti-schizophrenics and also some beta blockers like metoprolol cause delays orgasm as well. Usually check the hormone profile. You want to make sure your testosterone levels are normal, your estrogen levels are normal, and then you can try dopamine agonists, right? Things that are going to raise your dopamine levels, like cabergoline, right? Cabergoline is a pill you take twice a week, and after 3 weeks, you should have a rise in dopamine levels in the head, causing more likely to have an orgasm, right? Another drug you can use is apomorphine. That's usually compounded now, so it's like a troche lozenge you put in your mouth, and it's got a short half-life. Another drug you can use is called bromelanotide. Its brand name is Vyleesi. It's actually off-label use in men, but I use it in men for delayed orgasm. It actually stimulates the brain, and causes erections and help with ejaculation orgasm. And other drugs you can think about using is oxytocin. Addy has also been used as well for delayed orgasm. I also get great responses from pelvic floor therapy and sex therapists intervening as well, because sometimes, the guy or the gal's like, okay, I can't ejaculate, I can't orgasm, can't come, and they're just thinking about that instead of thinking about what they're doing, right? And so sometimes it's a performance anxiety issue and not so much a chemical imbalance. Now, the bad news is as you age, orgasm intensity and the number of orgasms decrease as you age. So some of this is age related because your brain is tired, and you'll notice that you're more likely to be having orgasm or ejaculation earlier in the morning than later in the day. So if it's later in the day, it's just your brain is tired, right? It's been processing all day. So, it's a very complex thing to treat as a urologist, andrologist. Orgasmic dysfunction is one of the difficult things to treat because there's a lot of variability in what's happening, and there are a lot of causes that are outside, just here's the medicine and you're taken care of. Dr. Hakky with another Dick Talk.